Beginning in our discussion. We're going to continue right now. Congressman Scott Peters, Congressman Darrell Issa. Thanks again, guys, for sticking around. We're going to go a little bit more macro here now and include the White House. President Trump is about to make a key decision on Obamacare, and that is whether to continue giving taxpayer money to the insurance companies so that they can subsidize the poorest of the poor. If that money is pulled, their premiums obviously would go up. Do you support that, Congressman Issa?
Well, you know, it's an interesting point because the law specifically ended that behavior. Remember, the government is subsidizing the poorest of the poor. This is a question of backstopping rates, meaning that if the insurance company misses their guess and charges too little and loses money, it's a backstop. And no, I don't support it. I think that we have to look at the true cost of health care, subsidize it if the person's appropriate, but not then also guarantee that they'll still make a profit. And it's very controversial. What isn't controversial is the mission of Medicaid and our dedication to it.
Congressman Peters, speaking of subsidies...
I'll just say that...
oh, sure, go ahead.
The Trump decision will not just, if he does what he says he's going to do, you're going to see those rates that you've just announced double again. And that's not just for the poorest of the poor, that's for everybody. Okay. So let's be clear that this is a very destabilizing thing for the market. We need President Trump to step up and provide some stability.
Well, speaking of the subsidies and speaking of the president, now, members of Congress get, is it $12,000 to subsidize?
No, what we get is 80% reimbursement of whatever plan we're on. Which is true of all federal workers. What's unique about members of Congress is that in the Affordable Care Act, it was mandated that members go on to, quote, Obamacare, go on to these plans. So every one of us is either on something we pay for outside the government, or we're on the Washington, D.C. Obamacare.
Okay.
What was interesting was the law did not say that it would be reimbursed. That was a decision made by the Obama administration on behalf of Mrs. Pelosi that decided that they would reimburse us. And the president has to decide.
He said he wanted to get rid of that reimbursement.
It is legal for him to interpret that we are not to be reimbursed because that's the letter of the law.
Well, okay, so my question, though, is about the reimbursement. It's not, why was it, you know, would you support getting rid of it? That's not even the question. Why is it there in the first place? I mean, for Congress to pass laws, it seems like we should all be governed by the same.
No, because all federal workers get an 80% reimbursement or co-payment. The amount we're getting is not different than anyone else in the federal workforce, postman, mailman, IRS worker, and so on. What was interesting was this mandate to force us out of FEHBP, a program that are 10 million federal employees and their families are in, onto Obamacare. And that had an unintended consequence, which is it did not provide for the reimbursement. That was a decision made by President Obama.
Well, it seems like there's two messages from the White House. He's been encouraging Republicans to get back to the drawing board.
Two?
Well, I think there's been, we can boil it down to two.
Okay.
He's been encouraging Republicans to continue to work on repeal and replace, and he's also been saying we could do nothing and just let Obamacare implode, right? So I know what you're going to say, Congressman Peters.
I'm going to say there's a third option.
What's the third option?
Why don't get Republicans and Democrats to work together to save health care?
Yeah, it seems like the implosion option.
And why, as President of the United States, would you be advocating for the implosion of the health care system for any reason other than politics?
What do you think of John McCain, Congressman Issa?
You know, I've served a long time with John McCain.
I think everyone knows.
We were here.
The question of that, right?
No, we were here for the launching of the Halsey. It was a brighter, better day. I've been in theater with him. I've been in Pakistan. We once were at the base where Shorty Powers took off on that famous U-2 flight. He's a dedicated American who has given his life to public service and now has a terrible disease. But you probably mean, what do you think about him being...
Yeah. You know, without his vote, it would have gone to Mike Pence, and we would be having a very different conversation.
I disagree with his vote. I think he should have kept the process going because ultimately we needed to have a compromise. Having said that, disagreeing with somebody's vote should be based on, do you doubt his intent? I don't doubt his intent as a loyal
One more question on that, then. So I asked our viewers on Facebook if they could ask the two of you anything, and the one I got from multiple was for you, Congressman Issa, and it was the Republican Party has had 7 years to come up with something, a plan, and haven't been able to do that, even right now, publicly fighting and backbiting and all that's going. Why? Why is there no plan after all the 7 years?
You know, that's a great talking point, but it just isn't true. The problem is that they've come up with a lot of plans. There are those who would repeal, period. There are those who realize that, for example, existing conditions and portability, which was a Republican idea before it was in Obamacare, we might need to
Moving
change
it across state lines.
Right,
For
we
everybody
might
there,
need to
because
change
that
it.
could bring costs down, more
Right.
competition
So,
and more options.
You know, yes, there's a right and a left wing of the Republican Party, and each has some different ideas. I don't think we suffer from too few ideas. I don't think the Democratic Party suffers from too few ideas. What we suffer from is an ability to come together for the greater good in either party, and this is where Scott, his point is right. 100% repeal was never there, because there were things that we would want to preserve from the Affordable Care Act. Okay. How do we get to compromise? You know, look, the president's right on one thing. People need to continue talking. They need to continue expressing ideas. You know, I'm like a broken record. I keep saying, well, at a minimum, every American should have the ability to get into the federal employee health benefit plan programs to buy their way in, employers and individuals, which was something I proposed back when the bill was being passed, that more choice certainly should be something we can all agree on.